What if I told you that there's a better way to do healthcare? What if small acts of kindness and empathy can change the overall experience of your patient? There is a space before treatment, before diagnosis, before fear even arrives. And most people choose to move past it. I decided to stay. I always knew I was going to be a dentist. Ever since I was a little girl, I just knew it. And not because I grew up in a family of doctors or medical books or dentists. In fact, I don't even know why I was so into teeth. My parents were creatives. They were graphic designers, storytellers. They would shape emotion. So at a pretty young age, I understood something simple. The emotional experience can shape the technical one. When I first got into dental school, I fell in love with the craftsmanship, the art, the precision, everything. But it wasn't the enamel that got me into healthcare. It was the human connection. And my path with dentistry wasn't linear. In fact, I even pursued a different specialty at first. Pediatric dentistry was never the first option. Because as you know, working with kids can be hard, can be a little bit exhausting, and it is. Because in my field, fear doesn't wait politely outside, it walks in first. My job is about guiding babies, toddlers, neurodivergent kids, kids who love going to the dentist, you heard that right, love it, and kids who hate going to the dentist. And sometimes a parent who is even more afraid of the dentist than their child. All of this in non-pharmacological ways. It's not easy, it requires design, and it requires intention. So when I first started working in dentistry, I knew I had to find a way to connect better with my kids. And I started getting creative with it. I designed characters like Los monstruos de la boca, in English, the mouth monsters, so I could explain to the kids oral diseases and their importance and how to take care of them in a more positive environment. I started realizing that my patients weren't just coming in for sealants or extractions or for treatments. My patients were feeling something before, during, and after the experience. So the more you pay attention, you can see how a parent walks in first and how just by kneeling to a child's level, it can make a whole difference. The way we speak, the way we prepare our kids before treatment. Most doctors don't even do that. Have you ever been a patient who has received not so good care? It's not easy. When you anticipate a patient for what's going to happen, fear diminishes. So what I tried to do with my practice was create safe environments for my kids. And that understanding led me to know what in healthcare is known as the patient journey. And so you can understand it, you don't just arrive for a treatment. You go something before the appointment, during, and after. And when you prepare all those points, you're automatically making your patient and yourself a little bit more easy when it comes to the treatment you're doing. It's all about small acts of kindness and empathy. And I started paying even more attention to that. I started creating moments with the parents and with my kids. And those became the pillars of what I now call the WOW philosophy in healthcare. WOW philosophy in healthcare is something much more simple to understand. It's a patient-centered approach where you take the patient journey and learn how to add emotional value to every step of the experience. Because it is never only about the medical experience. It has to do with the emotional impact it has on our patients. And that learning didn't come from a textbook. It came from them, from my patients. Maria Antonieta's mom called me one day, and she said 6 doctors had refused to treat her daughter's broken tooth. And when you hear 6 doctors in pediatric dentistry, that is usually a red flag. But before we hung up, she said, Dr. Ale, just this one thing, Maria Antonieta is visually impaired, has some cardiac conditions, and some mobility challenges. So obviously, I understood the hesitation. But I didn't want to wait to prepare. I didn't want to wait for the appointment to be able to prepare Maria for her treatment. So I sent her a message and I said, "Hey, Maria Antonieta, this is Dr. Ale. Tomorrow we're going to meet. I'm going to use a tiny toothbrush that's going to tickle your teeth. We're going to have so much fun." So the day Maria Antonieta arrived, we had everything ready for her. Her favorite cherry toothpaste, everything, her scent, toys, you name it. We had it all ready. We had it ready for her. And that day, I was wearing a white lab coat with a tutu sewn on it. And when Maria Antonieta pulled over to touch the tutu, she said, "A mí también me encanta el ballet." In English, I love ballet too. So that was a really overwhelming moment for me because I immediately understood that going the extra mile is never extra when it comes to preparing for your patient. And this applies to every single area in healthcare. This is not just about dentistry, about pediatric dentistry. If we treat patients as if they were children, not in capacity, but in vulnerability, the outcome would be very different. Rafa's 3 years old. He's super energetic. He loves me. He knows my name. He runs towards me when he sees me, but the moment he sees a dental chair, he will stop. But Rafa has a cardiac condition, so he has to have a cavity-free mouth. There is no other choice. But I can't just sit him in the dental chair because if I do that, I will lose him in seconds. So we started adapting a space for him. And I didn't go straight up to the dental chair. I tried at first in a ball pit to see if it would calm him down and regulate him, and it worked. And then we started doing small treatments for him and adapting different spaces. You name it, sensory lights, spaces that looked like galaxy. We went the extra mile for our kids, and it worked. But Rafa taught me one thing, because safety cannot depend on a moment. Safety has to have protocols and systems. So we started designing systems and protocols for neurodiverse kids, kids who had bad experiences, babies, you name it. We've written and rewritten so many protocols because this is the only way we can make sure that they work. This is Chewy. Chewy spent 2 years being unable to eat because a medical condition had destroyed his mouth completely. Can you imagine a 5-year-old being not able to eat, not smile, not talk? The impact of healthy teeth on children is super important to development. So he spent 2 years without being unable to eat, and we were with him the whole journey. Every time he had to get a treatment done, when he felt it was hard or overwhelming for him, he would hold my hand. But just to let me know he was trying. And the day we put in his prosthesis, we were so happy because he was going to be able to smile, he was going to be able to eat. So I went out and told his dad, "Sir, you gotta be ready for this because he is going to be able to eat, he is going to be able to smile, but he looks incredibly handsome." And everybody in the room got so happy for him because it was like himself meeting himself again. And that moment wasn't about the dental prosthesis. It wasn't about the treatment. It was about dignity. It was about protecting a child before vulnerability. So we started applying hospitality to every one of our patients. Hospitality became the DNA of our practice. We went all the way for our kids. If we had to create different spaces, if we needed to play with them, dress up, be with safety dogs, you name it, we will try to go all the way for our patients because I remind you, we are trying to do this in a non-pharmacological way. And you have to care for that space before. None of this could have happened by just myself. I have a group of people who are not only trained, but they actually care for these children. And that's such a hard tribe to find. When you meet people who feel the same way or can have this joint idea of this vision, everything works out easier. And it wasn't just about our practice. We started taking it everywhere. Community visits, the same we were we applied hospitality with our patients, we do it with the team. And we try to spread this message of love and empathy and kindness to all the families in our community. And this has not only helped us work better with children, it has prevented us from burnout as well. Because when you have a structure and when you have a vision, you work better. Our patients, when they left the clinic, they all left saying, wow. Not because of the scrubs, not because of the decoration, but because of how they felt. They felt safety. They felt cared for. So the pillars of the WOW philosophy, there's many elements to it, but the 4 pillars that you can all apply to the area you're working in, you don't need to be in healthcare. You can do it from another point of view, from another career, or from another profession. But the pillars are very important. Anticipatory psychology, cultural organization, processes and protocols, and of course, medical hospitality. If you apply these 4 pillars to whatever you're doing, I can reassure you that the outcome will always be better. And this brings me to my beginning. My mother was a graphic designer. She was probably one of the most creative women you will ever meet. She and I designed the whole visuals of my practice, from the mouth monsters to the walls to the tooth fairies, you name it. Our stories were everywhere. I thought at that moment we were just being creative, but I didn't really know that we were building something so much deeper. And suddenly, our roles shifted. My mom became the patient, and I became the daughter in the medical rooms. And I don't know if you've been there, but when you're on the other side, when you're not the doctor building safety, that feels bigger. The quiet is amplified. And at that moment, I understood the lack of empathy with your words. When the doctor would come out and tell us the not so good news, it makes me even nervous just to be remembering this story. But I felt the impact, and I knew that this message wasn't just in dentistry. It applies to every area in healthcare, and we must do it. If you have the chance to design the space before, do it. Because when you're changing it, if you create a better conversation, if you do it with more empathy and kindness and love, the outcome is not only going to be clinical, it is going to be human. I always knew I was going to be a dentist, but what I didn't know was that my greatest gift was to come from a family of creatives who are not only going to teach me how to treat teeth, but to design the space before. Thank you very much.